Dr. Kevin Harvey, the head of the Department of Epidemiology and Director of the National HIV/STI Program. Dr. Harvey.
Good morning, ladies and gentlemen. Honorable Prime Minister Bruce Golding and Mrs. Golding, Honorable Minister of Health Rudyard Spencer, our Chair Howard Hamilton, Dr. Fenton Ferguson. I want to take this opportunity to welcome you to this special World AIDS Day breakfast, other distinguished members. The HIV epidemic has been one factor that has united the world. And the challenges that we face are all similar. Jamaica is linked in a group called the Latin America and the Caribbean. And this group is always compared to Sub-Saharan Africa, Asia, etc. And hence the video that you've seen, where we're showing a little bit that of the similarities between Jamaica and the rest of the Caribbean. You need to put the mouse there so I can get to it. Just put it on top of the other computer. Close it down and put it on top. So I'm going to take you a little bit through the Jamaica's response and to see where we are, some of the similarities, some of the vulnerabilities, and some of the factors driving the epidemic, as well as some of the achievements that we have had over the last few years. The mouse. I have to point on the mouse, right? Yes. Still not working. Can I use the... Technical difficulties. All right. So Jamaica, as of yesterday, our prevalence rate has been revised to 1.8%, coming from about 1.5 over the last 5 to 10 years. And about 2 years ago, it was revised to 1.6. Now, the prevalence rate reflects the number or the percentage of adults who are living with HIV. An increase in prevalence rates shows that we now have more persons living among us with HIV infection. And this is due to the fact that persons are no longer dying from HIV, as we will show a little bit further. We need to prevent more new infections in order to get this rate to go down further. We now estimate through a UNAIDS process that Jamaica has 27,000 persons living with HIV, and a significant proportion are still unaware of their HIV status because they have never had an HIV test. A number of persons are in need of the life-saving antiretroviral drugs, and now we are estimating that about 14,000 persons are in need. Yesterday, the World Health Organization have revised their treatment criteria to start in persons on antiretrovirals much earlier, and hence we are now estimating that more persons will need treatment because we are starting earlier. We are covering about 6,500 of these persons. And about a week ago, our estimate was about 8,000 persons in need of treatment. So we thought we were doing extremely well, batting at 70%. But now we're batting at 43% because of the revision. Keep in mind, however, that the Caribbean's coverage is averaging at about a little over 50% of the persons in need of treatment in the Caribbean are actually receiving treatment. And as I said, Jamaica, Bahamas, Trinidad are among the groups doing the best in this area. Now, the epidemic is a sexual one. 69% of the persons infected are reporting being infected through sexual transmission. We have about 7% of persons infected from mother to child, and a few unknowns, very limited, about 12 persons through blood transfusion over the past 20 years, but I don't think we have had anybody over the last 5 years being infected through blood transfusion. When you look at the risk behaviors, we're seeing that 80% of the reported cases of HIV are reporting multiple partnerships. So the persons who are affected are persons reporting multiple partnerships. 20% of the persons infected also reported having sex with a commercial sex worker, and 44% of them had a previous sexually transmitted infection. And we know the relationship between STIs and HIV. When we look at it by age group, we see that the group that is mostly affected is between the 15 to 49 age group. And in fact, 86% of the persons infected are between 20 and 60. We have a particular challenge among our teenagers. And if you look at the graph in the 15 to 29 age group, which is the fourth from the left, you can see that 3 times as many female teenagers are infected compared to the males. And even when you go to 20 to 24, you can still see about 1.5 times as many females are infected as males. When you look at the opposite side of the graph, you can see that far more males, the males are in blue, females are in red, far more males, the older males, are more infected compared to the females, and the younger females are more infected compared to the males. And if you break this out a little bit more, the females in red, you can see that in the adolescent group, we have a significant problem among the teenagers, where the teenagers are far more infected. The female teenagers are far more infected than the males. And this has to do with some of our transgenerational sex and the fact that some of the older men have never had an HIV test and do not use condoms. HIV/AIDS knowledge in Jamaica is very high, and most people endorse corrective methods of prevention. However, we still have a little bit of challenge with stigma and discrimination, where only about 15% of certain age groups are reporting complete accepting attitudes towards persons living with HIV, and hence some of our anti-stigma campaigns that we have been launching. The program, however, has had major achievements over the years, and we have managed to have a national HIV/AIDS policy, which was approved by Parliament in 2005. And we have had several workplace policies, including one from the Office of the Prime Minister and most government ministries. And we have also, with the Ministry of Labour and Social Security, facilitated the development of the Occupational Safety Act, which is now going through the process. Jamaica's had a strategic plan, and the strategic plan was ratified late last year by this present government and the entire Parliament, and it focuses on 4 major areas: prevention, treatment and care, enabling environment, empowerment and governance. And it's costed at about $200 million over the next 5 years. We have been able to map our HIV infections and we found that this somewhat overlies some of the areas with other vulnerabilities, like low socioeconomic status, etc. And we have been able to do studies which document our situation in Jamaica explicitly, and we were able to determine the prevalence rate among our